Very much, and great to be here with you all today. Following on from Sayo's really interesting kind of overlay of the landscape and the situation, what I wanted to talk about today was three things really. First of all, to provide a bit of an introduction to Health Data Research UK, who we are, what we do. A little bit about then some of the interviews over the last year that we've been having, and some of the outcomes from that about what people's kind of the challenges and obstacles associated with health data research. And then what I would spend most of the time on was actually talking about what we're actually doing about it. So some of the practical steps in terms of what we're taking to address some of the challenges that Sayera set out and where we are on that journey, so you can kind of hear where we are at this point in time. So, Health Data Research UK, our mission is to unite the UK's health data to enable discoveries and improve people's lives. That's what we're about, that's what we do. And that's what we want to keep front and centre. It's about making a difference to people. And why this matters is it bringing benefits for all. So if you're a researcher, being able to get data quickly, more efficiently, and being able to do your research and development. If you're a clinician or patient, getting to actually better medicines and treatments, technologies that are more meaningful and more effective. If you're a business, actually being able to test and deploy products sooner, faster, more effectively. And then for all of us, a society, that we're actually both creating jobs and opportunities, but also getting better healthcare for all of us. So there are benefits that come out from all of us from doing this. Health Data Research UK was launched in 2018, and it's the National Institute for Health Data Science. So it's a new area developing across partnership with NHS, industry, academia, patients, and the aim is what we're really focusing on is providing safe and secure access to healthcare data. And we're funded by, as you can see, a range of different organisations and across the 4 nations, and that gives us a kind of and we're based in the Wellcome Trust. So, and in terms of our kind of central organisation up on the Euston Road. So what we are is a national institute. But we're actually federated across the UK, so drawing together a whole range of different organisations, universities, and different across the 4 geographies. We are, as it says in there, quite clear aspect of it is what we are not is we're not a data controller. So what we're doing is enabling and supporting, but we're not actually a data controller ourselves. So the thing that we're actually doing then is actually about bringing together this kind of partnership across these different parts of the environment, across the ecosystem, to actually create a world-leading and robust health data research infrastructure. And so that's what we're really focused on doing. And what I'm going to talk through today is a little bit about what that actually means in practice. This is part of the industrial strategy, so many of you will be familiar with that, and a programme that was launched last year, a 4-year programme, something called the Digital Innovation Hubs programme, is one of the aspects that we're leading. So over last year, we've been talking with over thousands of people to really understand what is it that people actually want from health data research. If you're in academia, what are you needing, what are the obstacles? If you're a patient, what are you concerned about? If you're a business, what are the challenges that you're encountering? So we can really understand actually, therefore, if we're wanting to build an infrastructure to address that, what actually is it trying to do and what challenges we're trying to tackle. And the sorts of themes that came out, which Sayera has touched on many of these already, but in terms of the kind of this message over, which David opened with, is that we've got these fantastic data resources, but it's very difficult, first of all, to actually know what exists. So they exist in we talked about it kind of being in this kind of very fragmented setup, so even knowing what's actually there, and then once you know it, actually being able to access it is hugely challenging. As a result, things that innovation and research is happening outside the UK because it is so challenging to be able to do that. We also found that, and Natalie I'm sure will touch on this in much more depth, that members of the public do see the value and benefit of health data being used, provided they understand how it's being used and it's transparent, and they understand how it links back to the benefits to the NHS from that. And it's been really clear it's not just lip service towards that, but genuinely how that actually works in practice. And then how we involve people through this journey, so how patients and public are involved throughout. So what we're wanting to do is to then actually work on these 6 areas of actually what people actually want from health data. So the type of data people want is actually, so if you're a researcher or an innovator, being able to get longitudinal, so data over time. We can get multimodal, so different aspects of data, so be it the data that when you go to a hospital, how that connects to your genetic data, how the wearables you have, so being able to build up a kind of a multi-dimensional picture, so you can actually do research on all the aspects of the environmental aspects and different areas on that. Then being able to get access, so being able to have a single, easy-to-use route to data, so that you've actually, what we often hear is that the challenges of, and in the speed side as well, up on the fast response times, is there's huge challenges for people actually. If you're doing research, you put an application in, and then people have, can be months, it can be years in some cases, before the data comes back. Once you've actually got the data, which makes this point down the scale of quality, is then people then find actually it's not even the data they want in the first place, or the quality that's not up to date. So the delays and the inefficiencies on our kind of on innovation and developments associated with this are enormous for us as a society. We've then got the points on expertise and being able to use it for different purposes. So getting into the kind of concepts of real-world data and much faster turnaround times in terms of actually what's happening in the real world. We've established at HDO, we've got one of the very first steps we had was establishing a public advisory panel. And I'm kind of putting this up fairly front and centre of this, because this is one of the first steps is we need to make sure that everything we're doing is about enhancing, building trust and really understanding what that means. So we have a public advisory board who help us on that. That's just a starting point. It's then actually how, as we make decisions, that we can be confident that we're understanding the public views on this, that actually people are confident in the approaches we're taking. We're also investing in science. So we have a range of different science areas. So we've got the 6 areas listed here. And these are about actually being able to demonstrate the value and benefit of doing large-scale health data research. So from actually, can we see what the benefits are improving public health? Or can we see how I'm actually going to receive better care at a hospital as a result of this? So a huge range of different opportunities to really demonstrate the effect and outcome from that. And what the aim is over time is to be able to get to a kind of sense of scale across 3 dimensions. So being able to get across the population within the UK, being able to get the longitudinal sense of someone over time, being able to capture what happens and the effects over time, and then also being able to get to this multimodal detail of different aspects of people's lives, so that really you can do research in a way that you can be confident you're getting an understanding of actually the full effects and the full effects on a person. So across the UK, we've got a kind of geographical presence, which I mentioned, across many different universities, of which hopefully many familiar names and things in there. And this means that we have this kind of presence and being able to build on and draw on the strengths of the UK, which is one of the distinctive aspects of the UK, as well as having the NHS. We have this extraordinary resource base, a research base across the UK, which we're drawing on, and the expertise from that. And then it's about building the people and the capabilities. So within health data science is a new field. So if you talk to, it wasn't a career when I was at university, if you talk to your average 16-year-old, this is the type of thing that they're really excited about. How can I'm interested in science, I'm interested in maths, but I want to do something that actually makes a difference to people. So how we actually start creating those career paths for people that we can really tap into from an early age and create these paths that this is a field that people want to come and work in, that either be in the kind of academic environment or in the NHS or in industry. This is a whole new profession, and how we build that is an exciting next step for us. So now going to the infrastructure itself. So I just touched a bit on the science there and some of the aspects on the people building, people capability building. Actually just touching on the infrastructure. We've got 3 broad parts that we're developing. One is an alliance, so bringing together, so you can see on the left-hand side there, bringing together the health data custodians. And so you can see a list of things I'll just touch in a moment on which organisations are part of that. That's around actually bringing together people who are custodians of data and starting to work out with them and having them to be able to take a leadership role of, I think Sayura kind of mentioned some of the challenges of where is the expertise in these different organisations. Well, actually, let's bring them together and have them collectively solve the problems together on this. Actually, what standards do we want to have around data quality? How do we want our principles of participation to be working on this? How do we want linkage to be working across data sets? So that's what the Alliance is doing. We then have a middle piece, which is the hubs, which are the health data research hubs. These are then taking the data that exists in these fragmented environments and actually drawing that together, curating it, so improving, enhancing it, providing value-added services, so being able to add value services around clinical trials or real-world evidence, and actually then also looking at actually how can linkages and be added to that. And the final piece then is around the gateway. So it's just, I mentioned at the start that one of the challenges is not being able to know where the breadth of what data exists. The gateway is providing a common portal that allows people to understand what data there is and to be able to discover that. So on each of these, I'll just touch for a moment to give you a sense of what sorts of things are in there. So in the Alliance, This started earlier this year. There are currently 18 members, and we're just about to announce another 10 in the next few weeks. And you'll see the kind of breadth of different organisations here, and this is just kind of scratching the surface of the types of data there is. So in sense of fragmentation, there are hundreds of organisations who have got data of different types that we're wanting to draw together on this. So you can see national bodies, NHS trusts, charities, and research cohorts. And across those, what we're wanting to do is actually get kind of aligned around standards of data standards and quality, actually linking through this kind of concept to the bottom of trusted research environments. If we can all agree how data, the environment within a data which is held, and a common standards as to what's on that, and a common sense of trust on that, then that allows you to then make linkages if you can trust the different sets and the different environments on there. That's a little bit on that. And then the hubs themselves. So these, this was a competition part of the industrial strategy launched earlier this year. It was really interesting. So the aim was to drive kind of collaboration across these dimensions of NHS, academia, industry, and charities. And what we then got was over 160 organisations applied in different consortia and created these different consortia, each of which has got those different aspects within it. And one of the real values we found from this coming through is actually how do you partner in those different types of organisations? How do they work together to deliver a common goal? And you can see Lord Darcy's getting lots of advertising this evening. Then we've got, these are the hubs. So these are the 7 hubs that we've started with. And so you'll see a range of different areas. So we've got some which are in disease types, so respiratory, health, cancer, really interesting things on eye disease, bringing on the work that Moorfields have been involved in that, so they're part of the Insight Hub. And then were areas around real-world evidence, so with Discover Now, and also around clinical trials. So a very interesting and diverse organisations working across the different areas on that. And geographically present across the UK as well. So you'll see the slightly confusing picture shows the kind of the hub, the centre of where each of those hubs is, and then the geographical spread of the different areas. And then the gateway, it's saying red, time's up, so I'll just do last second on my last slide on that. So the gateway then is about providing a common portal. And Nicole's going to is working on the IBM side on this. What we're doing is developing this in two phases. One is around the minimum viable product, which is getting us up and going, and the aim for that is to go live on the 10th of January, so we're all working very hard on that at the moment. And then the second part is then going for a deeper and more sophisticated model with a technology partnership which we're commissioning at the moment. So lots happening in this space, and hopefully we'll have lots more to say over the next few months.